Good afternoon, everyone, and welcome to our webinar on returning to the workplace. So my name is Anna Christie. I'm the Chief Executive for the Sussex Chamber of Commerce. We will shortly have an update from our speaker and expert, Harry, who's an employment specialist at Sherrards Employment Law. He's the principal at Sherrards. So guidance has been coming out from government. It's been emerging over the returning to work and what employers need to consider to take care of their staff and how we should be supporting the health and well-being of employees. So without further ado, I'd like to please welcome Harry, who will provide us with an update. Harry, thank you for joining us today.
Okay, thank you very much, Anna, and thank you everybody for joining the webinar today. Okay, so I'm going to look at four aspects of the issue this afternoon. That will be the occupational health factors, health and safety obligations, employment law, and I'll also look at some issues that are arising on the data protection side of things and privacy. And I'll hopefully be giving you some practical guidance on all of those points. So, as Anna mentioned, we have an employment law firm here, but we also have a sister business, which is Sherrards Occupational Health, and we work with a number of medical practitioners and occupational health and physicians. And Dr. Stuart Tomlinson from Medwin Surgery up in Dorking, he's one of our main collaborators, and he gave a webinar on the medical sides of COVID-19 and return to work. And I'm going to pick up on some of the points that he made in his presentation, which I think are of general interest. Since we are talking obviously about employees coming back, I think it's interesting to make this point. If we take the age of 65, obviously that's not the retirement age anymore and life has moved on, but if we take broadly the old-fashioned view of 65 being the end of the typical working life, it's notable that only 12% of deaths from COVID-19 were actually of the working population, and 88% were therefore over the age of 65. Various other figures, 60% of deaths were male and 40% were female, so males for some strange reason much more at risk. Black and other minority ethnic groups are also significantly more likely to die, and Dr. Tomlinson showed us some analysis that black individuals are actually 4 times more likely potentially to die than whites, and nobody really understands that. Looking at the world of work, again, males in low-skilled manual work are again 4 times more likely to die than males employed in professional occupations, and presumably that is because in manual work, employees are in closer proximity with fellow members of staff, and professionals are largely working from home. Oddly for females, the mortality rates between professional and low-skilled occupations seem to be quite similar, so again, all sorts of statistical anomalies. Another one to be aware of, and this all feeds into how you do manage the return of your staff to the workplace, is that there's a significantly greater risk for individuals who are obese, and in fact those with a BMI of 40 or above are officially classed as moderately vulnerable. Now, COVID-19 is obviously highly contagious, but at the same time, I think it's important not to become oversensitized about it and how risky it might be in certain circumstances to catch the infection. One of the points that Dr. Tomlinson made was that a brief passing in the corridor or something like that, spending like a second or two in much less than 2 meters proximity of another individual, it's pretty much impossible to catch the infection from that kind of exposure. And he surprised me by saying that an air transfer is only likely to result after 15 minutes of exposure. So we will go on to look at one-way corridors and so forth, and some of these things are still recommended. But as I say, the chances of infection passing through a kind of fleeting being close to someone is effectively close to zero. So rather than airborne transmission being the main problem in a workplace, it could well be surfaces and things if someone affects handrails and door handles and things. So hygiene is one of the big subjects which we will return to later on. So that's some information from the occupational health side of things and the medical side of things. So I'm now going to go on to the second part of the presentation, which is health and safety. Now, as we know, the Health and Safety at Work Act requires employers to carry out risk assessments. Obviously, that's not new. That's been around for decades. And employers are responsible for the health, safety, and welfare. Don't forget about the welfare. That's an important point as well, potentially, of their employees so far as is practicable. A quick technical point about how health and safety legislation works is it can't be delegated. So in other words, sometimes you might see in similar contexts to saying to an employee, you do this at your own risk. If you want to come back, and we'll come onto this point later on, where you don't particularly want an employee to come back and they're pushing for it, you can't say to the employee, you do this at your own risk. That doesn't work. It's null and void. It is always the employer's responsibility to manage the health and safety of staff in all circumstances. So I'm sure most of you know this, a risk assessment has to be in writing if you have 5 or more employees, and it has to be published if there are 50 or more. An assessment has to remain live, and it's subject to ongoing discussion and change as circumstances change. And of course, as we've seen with this virus and the pandemic, life does change pretty rapidly. So you need to consider that when working on your risk assessment. Now, for some workplaces, the risk assessment is relatively straightforward for offices, for example. But of course much more complex in a factory or other industrial setting. And the government has published 8 sets of business sector specific risk assessments on their websites. When we send out the notes that I mentioned earlier on, embedded within the notes will be the link to that government website where you can go and access those risk assessments and choose the one that's most suitable for your business. So the risk assessment identifies hazards and then sets out mitigation measures for employees returning to work. So clearly in a factory setting, there's going to be a lot more thought has to go into that than other industries. But let's look at a couple of general recommendations that are likely to be applicable to most workplaces. So one important point is to keep employee density low, so that everyone can practice social distancing. So we do that here at Sherrards. We have 10 people working here, but we rotate, so we only have 4 or 5 in the office on any one day, and we're gradually incrementally increasing that. Ensure high standards of hygiene, in particular wiping down of shared surfaces such as door handles and so forth. As I mentioned earlier on, that potentially is a greater source of infection than airborne transfer. Hot desking, of course, was pretty fashionable for a number of years, but because of this pandemic, that's now not recommended. It's best for employees to have dedicated workstations so they're not sharing. Another tip is to, and again we've done this, is to reorientate workstations so that employees sit back to back rather than facing each other. I'll mention this later on in a different context, but when we breathe out, water droplets can travel for over a meter, and therefore working back to back is much better. If you can't do that, then you can install plexiglass between the desks. We ordered some plexiglass, and we thought everybody's been buying it, we're going to have to wait months for this, but it actually came really quickly. We've installed it throughout the office, and everybody now, it's a little bit like working in a goldfish bowl, but everybody now has plexiglass all around them. So if you are struggling to get hold of plexiglass, let us know, put it in the chat box, whatever, we'll pass on to you the details of our supplier. Can't guarantee they still have it, but a few weeks ago they did. Another suggestion would be to use staggered start times and finish times, again, to avoid people coming into contact with each other in the office. Have rotating teams on a shift basis. We've got one client who's got the yellow team and the blue team. They never see each other, and of course they're instructed that outside of work they mustn't have contact with each other either, and they rotate in and out of the office. Consider conducting meetings outdoors. Again, this is something we've been discussing, and I may have something coming up shortly that we're going to conduct outdoors. And another practical thing is to have one-way corridors. As I've mentioned a couple of times, a kind of fleeting contact in a corridor is highly unlikely to result in cross-infection, but maybe it's something that makes the staff feel safe. From that point of view, it's a good thing to do if it's feasible. Now, a lot of employees, of course, will continue to work from home, and on the subject of risk assessments, it has always been all the time since we've had health and safety legislation, it's been a requirement to carry out a risk assessment of the home workspace, make sure everything is safe there, no trip hazards and so forth. Well, obviously, it's a very difficult thing to suggest that an employee is going to go out to someone's home and carry out an assessment. It's not really feasible at the moment. So there is a self-assessment form that's actually available on the HSE website. Again, the link to that is embedded within the notes that we'll send out to you later, so you can access that and ask employees then at home to carry out their own personal risk assessment. And another suggestion is to ask them to send in photographs, or even this day and age a video maybe of their working area, and you can do a kind of a remote assessment of their workstation. So what other things might employers be thinking about doing? For example, conducting temperature checks of returning employees. Now that's probably not feasible for most employers because temperature checking equipment needs to be validated, staff needs to be trained to operate it, and if the person conducting the test would come in close contact with employees when carrying out the checks, the tester would probably have to wear PPE. So we see this kind of thing going on at airports and other environments like that, but I would think that for probably most employers, it's not really going to be feasible to conduct temperature checks. In addition to that, the medics tell us that about 70% of COVID-19 sufferers have a significantly raised temperature. So, you're potentially missing anyway a substantial tranche of the employees, the 30% that wouldn't be picked up by a temperature check. Now, what about wearing face masks? That's certainly been widely debated by government and the media. And as we all know, a non-clinical grade face mask provides very little protection to the wearer. So it's not about protecting the wearer. It does reduce the risk of spreading the infection to others. So when we exhale normally, water droplets could carry as far as 1.5 meters, and therefore that's where the recommended social distancing of 2 meters comes from. When we cough, water droplets can travel over 2 meters, and in sneezing, believe it or not, can actually result in droplets traveling as far as 6 meters. So again, as we say, the wearing of masks is all about protecting others, but it doesn't necessarily stop the virus getting to the wearer. So we'll now go on to look at some employment law aspects, and we'll pick up on a couple of points that I've just been discussing there in the context of health and safety, and that will be workplace temperature checks and a workplace requirement to wear masks. Now, neither of those measures are mandated by the government guidance, but can potentially be undertaken at the initiative of the employer. Temperature checks, if you're an employer that has the technical capability to conduct these. Yeah, I was just talking about government guidance and the temperature checks. They're not mandated by the government, but if you are the employer that has the technical capability to conduct temperature checks, then that's fine within the context of employment law. We'd say it's a reasonable step. I'll come back to some data protection issues in that later on, but if you have the capability, then yes, it's something that you could potentially do. As far as wearing face masks are concerned, we had a situation where one client, an American-owned company, because the Americans are quite keen on the face masks, the owner said that they did want employees to wear masks, and the employees objected. And they looked at the government guidance and said, well, the government doesn't tell us that we have to wear face masks, so you, the employer, can't make us. That's not correct. Government guidance is a red herring on that point, because employers have all sorts of dress codes, ways of using equipment and workplace rules that aren't backed up in government legislation. So there is certainly a body of evidence to say, as we were mentioning earlier, that wearing face masks is likely to reduce the area of transmission, and therefore if employers think that that's a sensible step to make, then it would fall within the ambit of a reasonable instruction, and it would therefore follow from that if somebody didn't follow that reasonable instruction, it would be a disciplinary matter potentially. You wouldn't particularly want to get into that situation, but you could. And more broadly, if employees are not complying with other measures that we've been talking about, maintaining distance, high standards of hygiene, etc., again, potentially that could become a disciplinary matter. If employees are keen to return to the workplace, but the employer has concerns about the health status, then suspension on medical grounds is possible and indeed advisable until more information about that individual is obtained, either from that person's own medical advisor or potentially from occupational health. Certainly you don't want to take any chances on this, and you need to be fully informed if you have any doubts or concerns. On the kind of mirror image of that situation, whereby you've got employees who appear to be reluctant to return to work because they've concerns for their health, there is a section of employment law that to date never really has been used very much, but now, of course, with the pandemic, it's becoming potentially more relevant. If an employee has concerns about health and safety and they assert a health and safety reason, it's automatically unfair to dismiss that individual. Now, most of you will be familiar that for an ordinary unfair dismissal case, you need a qualifying period of 2 years of service. But the health and safety automatic unfair dismissal is immediate. That applies from day one. So going down a disciplinary route with an individual who's refusing to return, difficult, because you do have that health and safety dismissal protection hovering in the background. In addition to that, employees do have protection from what we call detriment on the grounds of health and safety, and you're not allowed to treat them in any kind of detrimental way if that person has made an assertion about being concerned for their health, and I'll come back to that point in a moment. But just breaking it down into a little bit more detail, the protection applies if the employee has a reasonable belief that his or her health and safety is in serious and imminent danger. So the bar is set pretty high. The employee just can't have a very kind of general concern. They must think that it's a serious and imminent danger to their health. But obviously this law wasn't designed or developed with this kind of pandemic in mind, and it's awfully difficult really to predict really precisely how it's going to apply. Now, in normal circumstances, if an employee refuses to come to work, the employer can say, well, I'm not paying you then. But I mentioned earlier on about the detriment point, and it's likely to be the case that if somebody says, I'm concerned about my health, I don't want to come back to work, not paying that person could potentially be a detriment. Well, obviously it's a detriment, but within the legal meaning of that word and the health and safety legislation. So if we look at a little bit more detail at what the reasonable belief and serious and imminent danger means, the reasonable belief, to some extent, it's subjective, and it's the employee's personal perception, but it is strongly influenced by the measures that the employer has taken to protect staff. So if you take all the steps that we mentioned earlier on, rotating teams and social distancing and hygiene, etc., and you do all of that and you explain to the employees that you've taken all of these steps, then the more you do, the less and less likely it is that the employees can reasonably believe that there's a serious and imminent danger to their health. So provided you're taking lots of steps, you are put in a position where you can persuade employees to come back. Hopefully you won't get to the point whereby you're on the cusp of a disciplinary matter, but potentially that is the direction that you would be going in all of this. All terribly difficult, of course. Now, again, something which emerged when I was on a joint webinar with Dr. Tomlinson is about the virus and dealing with it, and dealing with return to work has kind of driven us to a different place in terms of information that we need to get from our employees. Some of this is very sensitive. So a young, fit, white professional female is in the absolute lowest category. But on the other hand, if you've got an older, black, overweight male manual worker, that person is in a much higher risk. So it does potentially drive the employer towards more intrusive questioning about the employee's characteristics. And many of those, of course, would be protected characteristics under the Equality Act. So, obviously, for many years, we haven't had dates of birth in job adverts and so forth, and we've all been taught that under age discrimination, we should never talk about age. But, is that employee 57 or 63? That actually becomes relevant because the 63-year-old potentially is in a significantly more at-risk category. Also very uncomfortable to ask employees about their BMI and other questions about ethnicity. So, as I say, in other contexts, those questions would be inappropriate. But COVID-19 has kind of driven us to a different place, and it may be necessary for employers to engage with those subjects. A particularly difficult issue, this may not apply, I suppose, to Sussex businesses quite so much, but maybe this is more a kind of a large city point. But if employees are persuaded and are happy that the workplace is as safe as is reasonably practicable, but their concern is about using public transport, it's my journey to work that I'm worried about. Obviously, the employer doesn't have much control over that potentially. We know that the government has recently stipulated the wearing of face masks on public transport, so that has lessened the risk. But it does maintain, or the position is maintained, that employees could potentially decline to return to work because of their concerns on using public transport to get there. So the furlough leave scheme does, of course, remain in place, and depending on how things play out, if you've only a small number of employees that are in difficult categories, the easier course of action might simply be to furlough them rather than necessarily engage in all of these rather difficult conversations. Other employees who have been unfurloughed and brought back to the workplace might be a bit upset about that. They may say, well, so-and-so sitting at home on 80% pay and I'm back out working. You can clearly see employees might grumble about that, but they wouldn't really have any legal recourse in that situation. Now, as we all know, the government early on in the crisis categorized certain individuals to be vulnerable and moderately vulnerable, and in those categories, people obviously have a variety of conditions. Dr. Tomlinson said there's no absolute bar on an extremely vulnerable employee coming back to the workplace in the near future, but clearly it's fraught with difficulties, and you're well advised to engage with the employee's GP and possibly occupational health to understand any additional steps that are recommended before a return to the workplace. But it is potentially possible. Flexible working, yeah, there's a lot of talk around flexible working and how the world of work is going to change permanently as a result of this, and I'm sure in many respects it will. And some people are saying that it's going to become much harder for employers to turn down a request for flexible working, because the employee can say, well, during the pandemic I worked from home, or I worked in some other flexible basis, and it didn't go too badly, so therefore that supports the idea that I should be able to continue flexible working. I certainly agree that employee expectations and the employee relations issues will potentially be difficult because of that changed mindset. But I don't agree that the legal position has changed in any way. The flexible working regulations are actually pretty employers, excuse me, they're pretty employer friendly. And whilst any employee can apply for flexible working on all different types of flexible working, the employer can refuse that on business grounds. So, for example, additional cost or adverse effect on delivery of service to customers. And the bar is set pretty low for employers. They don't have to prove some huge cost. They don't have to prove that there would be a highly detrimental situation as far as customer services are concerned. And they can, but nonetheless, they can successfully decline flexible working requests. So none of that has changed. And employers are still in the position to say, you know, yes, you did work at home during the pandemic, but there was a cost. It did adversely affect customer delivery of service. So I'm declining your flexible working request going forward. Obviously difficult because, as we say, employee expectations will be going in the other direction. One proviso to make on that is that if the person requesting flexible worker is a female who has caring responsibilities for small children, then that is a more complex situation because it does potentially engage in indirect sex discrimination. So employers who turn down flexible working, and that hasn't changed, of course, that's always been the case. So employers who turn down a female with small children who has childcare issues, they would require a greater degree of justification. We're talking about these various legal remedies and processes and protections and so forth, but I think it's worth making the point that employees don't have any quick fix in the event that they believe that their employer has transgressed employment law in some way. Before the pandemic hit, employment tribunal cases were taken up to a year to come to a hearing, and in the meantime now the tribunal system has completely ground to a halt, and all of our hearings through the summer have all been cancelled. So there's an absolutely massive backlog of cases, and a significant case started now. Anybody's guess, it could take 2 years before that would come to a substantive hearing. So, you know, employers may take certain actions now, but you've got 2 years to resolve that, if you like, with the employees further down the line, and there's no quick way for employees to get remedies. I think another important point in this whole debate is for employers to take into account collateral health damage. We've seen in the media, I'm sure you've all seen it, that treatments for serious conditions such as heart problems, cancer and so forth has plummeted. My brother-in-law is a GP, he's kind of retired these days, but at their surgery on a typical day, they might have slightly over 100 people come through the GP surgery. And there was one day a couple of weeks ago, there were 4 patients in the entire day that they saw. People just simply aren't attending to other medical complaints because they're very concerned about going to doctors' surgeries for obvious reasons. And of course, again, there's been a lot of discussion about the damage to mental health caused by isolation, and we've seen a lot of that. You know, work is good for you. Maybe all your staff don't necessarily see it that way, but I think there's plenty of evidence that says work is good for you. Interaction with fellow employees is good for you. And if you are in a discussion, a debate with employees about return to work, I think that you can legitimately promote the wider health benefits of a return to work if employees are showing some level of reluctance. So turning now to data protection, I'm only going to mention it relatively briefly just to flag it up. If you're gathering in data about employees' health, that of course falls into one of the sensitive categories, and you need to make sure that data is processed in accordance with GDPR. Data needs to be kept secure, should only be seen by people who need to know about that. You should also potentially consider privacy impact assessments. You should try to keep people's health issues as private as possible. How do we go through these processes with the minimum impact on that individual's privacy? Someone mentioned that there may be a way of temperature testing being conducted by an individual. They can do that on themselves rather than somebody else doing it. That's a privacy point as well. So those kinds of things, you need to think those through when you do your privacy impact assessment. The whole contact tracing side of things is a developing picture, as we know. As that comes on stream, it may be that some of your employees who are back in the workplace are identified as having come in contact with a COVID-19 sufferer. Now, if you then tell other employees that has happened to this particular employee, you are then potentially divulging information about that person's health quite broadly. Now, pre-COVID, we would say that's a complete no-no. You can't discuss people's health in that way. But as with many aspects of all of this, we are in uncharted territory. But in the situation, it may well be reasonable to identify that employee who's come up on the contact tracing to other staff, so that they can consider appropriate action. All pretty difficult. So one point I was going to make as I conclude, I mentioned earlier on that we have an association with various occupational health businesses, including Medwin up in Dorking, and they can conduct antibody tests. Now, there's not complete clarity as to whether previous sufferers of COVID-19 have indefinite immunity to the condition, but they certainly seem to have some level of immunity. So if you think it's appropriate for you or any member of your staff, you can go there and have an antibody test. They take a blood sample, it goes up to London for analysis overnight and comes back within about 48 hours, and the cost is at £75 per person. So those tests are available. So that Anna effectively completes the formal part of the presentation. So I see from the chat box we have a number of questions. So do you want for you to read out the questions, Anna, or how do you want to play it?
Yeah, let's go through the questions on the chat first, and then we'll see if anyone's got their hand raised and we can open it up. I have a few further questions myself as well. So there was a question from Claire. I don't know if you want to come in on this, Claire, at all? You raised a question about the BAME community.
Yeah, I have to confess I haven't actually read many of the media reports about the news that the BME community is more seriously affected by COVID, but on the face of it, it seems like quite a strange claim without understanding the variables underneath that give rise to that. So it feels like we're only getting past the story because there can't be a genetic predisposition to COVID-19. That doesn't seem to make sense. So do we know what the learning is, whether it's a housing or an access to healthcare or an occupational risk that people have been subjected to, or is there any more information about that?
No, there isn't. It's an emerging picture, and we just have to wait and see how this all develops. But that Dr. Tomlinson had a chart with different ethnic groups, and there's a curve, and as you follow through different ethnic groups, there's a definite curve, and with black people and Asians are one category down, but it's bizarre. But the answer is no. Nobody really knows yet, and all this will emerge in the years that follow.
Okay.
Thank you.
Thank you.
I just put a comment here about face masks and face coverings because I know there's been lots of confusion over this, and I know that if you're travelling on public transport, it will be mandatory that you will have to wear a face covering. Because I understand that face masks are more for surgical, healthcare, hospitals. And face coverings, which are the non-surgical ones, are the ones that can be used by employees, those travelling on public transport, or if they wish in the office environment, if it's not compulsory. Is that your understanding, Harry? Because I know there's been lots of confusion over this, and so it was just to get some clarity.
Yeah, I think the position is clear. Yeah, the government has not mandated that in normal workplaces, non-medical places, that people have to wear face coverings or masks. So it's not mandatory from a government point of view. But as I mentioned earlier on, if a particular employer makes a judgment that there is sufficient benefit to be had from asking employees to wear face coverings, then I will ask them to do that, and that becomes potentially a reasonable instruction from the employer. But again, there isn't necessarily this direct connection between what the employer considers to be appropriate and government guidance.
I think it will also depend on the business or the workplace, because if the employer is unable to put in certain measures like the perspex between desks because of costs, because a lot of us have been impacted financially, and that's a cost issue, then it could be that they go down the route of saying, right, the way we protect you is either seating people back to back or side to side, not face to face, but you have to, or if it is face to face, by wearing a face mask, for example. Could that be another option?
Yeah. All these things are option, or the plexiglass, of course, that I mentioned earlier on is another option. So there's no absolutely right way of doing this, and employer discretion and judgment comes into it.
Okay. The next question here is from Roger Sargent about employees who have childcare issues. Do you want to come in, Roger?
Yeah, can you hear me?
Yes, I can, yeah.
Okay. Yeah, it's just that we have, we're a sort of family-run business, if you like, taken over by a larger company now, but we still have those sort of morals in our background, and normally we give people time off if they have personal issues. But the whole working from home has gone on for quite a long time. And as Harry said, we like to encourage people to come back to work. And in actual fact, we've been painting the picture, as he said, that it's good to come to work and it's good to interact. In actual fact, we found that the managers have found it harder trying to manage people because they haven't got that social interaction. It's all an organised telephone call and things that needs to take place. But we are aware that we have a number of people who are still at home because they have childcare issues, because schools and nurseries being closed. And there's another point there that I've made, that we've continued to pay those people full time, full employment, but their wives are returning to work. But they're getting full time, so their incentive to come back, if you like, due to childcare is not as strong as it should be.
Yeah, it's I mentioned earlier on about female mothers of small children having potentially an indirect sex discrimination claim or protection in that situation. Males don't. So you are able to insist, I guess, is a pretty strong word. You're able to encourage your male employees to come back to work without fear of the indirect sex discrimination claim that would apply if the genders were the other way around. So I think you are in a position to maybe to take that another step forward, Roger. Before people get too comfortable and get into too long-term working from home issues. But certainly if a female employee has childcare issues and so forth, in effect that person is making, they may be doing it on a relatively informal basis, but in effect they're making an application for flexible working. And as I mentioned earlier on, if it is a mother of a small child, then you do need that justification to insist when they come back to work. So it would be pretty difficult in that situation in the medium term, I would have to say, before the schools reopen.
Okay, thanks.
I think like my brother and sister-in-law, for example, they've got a very small child who's just gone back to their childminder, but it's on a one-to-one basis. Now, there will be some nurseries that will have multiple children. Some parents will be obviously anxious about allowing their children to go to a childminder or child carer that's looking after several children, because you can't track and trace who they've been in contact with. But with schools being closed, that would have been they would have normally been closed in July and August anyway. I know that nurseries might not reopen. So there are issues there in terms of how employees can get back to work and who will look after their children. But I understand as well what Harry's saying in terms of then it's going down the flexible working route. So yeah, it makes it very challenging, doesn't it, Harry?
Yeah, it does. And you know, there's another point I was going to make this towards the end, and I'm sure many of you've picked up on this. And Roger, it might be relevant to your situation. Is everybody aware that effectively tomorrow is the last day on which new entrants can be put onto furlough leave, because it closes to new entrants on the 30th of June. And if you count 21 days back from the 20th of June, you reach the 10th of June, which is tomorrow. So literally tomorrow is the last day. So it could potentially be a solution in your situation, Roger, would be to put people onto a furlough leave rather than fight with them to get them to come back to work, as it were.
Yeah, I think actually we've tried to avoid that. We've had a few young students that are on training courses on furlough, but generally all of the people who are long-term employees, we haven't gone down that route. We've continued to pay them. So, you know, we have been, I think, very fair and reasonable, but we're just asking people to get back in the groove, so to speak, of, you know, coming into work at set times and being available for other people that might ask questions of them.
Yeah, I mean, I think some employers have taken the view, you know, that have been, you know, generous like you and haven't furloughed a lot of people. But if you end up with a you know, a troublesome case, a difficult case, it's the line of least resistance, isn't it, to furlough the individual and say, well, for the next month at least that situation is kind of taken care of. It's not ideal, it's not where we want it to be, but if we furlough the person for a month or two, then let's see where we are after that and bring them back. Now, you may have the issue which I mentioned earlier on. Other employees might say, you know, that's not particularly fair. Here I am working away, and he's at home getting 80% of pay. But you know, that may be just something that everybody just has to cope with.
Yeah, and as Harry mentioned, unfortunately, the furlough leave, the last day that you can furlough starts is tomorrow, so it would need to be done straight away. There's another question from. Sorry, Harry.
I was just going to make one other point on that. The government guidance in the early stages was quite confusing. It was contradictory as to whether employees had to sign a furlough agreement. But we've now got to a place where we know that they don't have to sign a furlough agreement. All they have to be is effectively is told. So if you tell somebody tomorrow morning that they're on furlough leave, then that's enough. They will then be on leave from that point onwards. But the HMRC have got the ability to carry out audits for 5 years on all of this. So, you know, in the event that they audited you, they may look for the documentation and they may say, well, show us the evidence that this employee was put on to furlough leave on the 10th of June. So, you know, you do need to have your paper trail ready and keep it for 5 years.
Claire's asked another question regarding sick leave and pay for an employee who's now having to have longer surgery rather than keyhole surgery. Claire, is there anything else that you wanted to add to that?
It was just given that we know that some healthcare has been unavailable in the recent months, and so some people are going to have either a longer recovery time because their conditions have been delayed, or they've got to have more complex surgery now because the keyhole surgery, for example, is not available. Are there any allowances that the government's making for sick pay or sick leave in those circumstances?
Not that I'm aware of. Obviously, the starting point is the contract of employment and what sick pay is allowed for in the contract. Obviously, that would apply, but traditionally people could get SSP for about 6 months or so. I haven't heard. Some other things have changed in SSP. So, for example, if somebody is caught up in the contact tracing side of things, they're symptom free, so they're not sick in the conventional sense of the word, but they would get SSP in that situation. But I've not heard of the government extending it in the way that you've just suggested.
Okay, thank you very much.
Just seeing if there are any other questions at all that anybody would like to ask, please raise your hand or send it through the chat. I had, where was it? Interesting that you mentioned about having some outdoor meetings moving forward, because I know that in a week's time some in about a month's time, that some of the venues are going to start opening up, as long as it's outdoor, for example, whether it's pubs or restaurants, as long as they have the outdoor facilities and can keep social distancing. So I was interested that your comment about the outdoor meetings. I think that social interaction is really important, because I think a lot of us have all had these meetings for the last 3 months on Zoom and Microsoft Teams and everything. So I think that was, as long as we're keeping that social distancing. But when it comes to outdoor meetings, I presume there has to be a consensus on both parts, that you're both happy to meet outside.
Yeah, sure, absolutely, yeah. But it's just one of the ways life has changed, and one of the directions that we're potentially going in. Sort of slightly changing the topic, there's another point that I wanted to make, which is, from some clients have experienced, or the advocates, or I think somebody's not muted, what they have found is, and we've actually found this ourselves as well, is that it's the least experienced of your staff who you should bring back first, potentially, because the more senior staff are able to work, they're possibly able to cope working remotely, working from home, etc. for a bit longer. They have the experience, they have the resilience to do that. So if it fits in with your business and your staffing levels, I think that you should look potentially at bringing the least experienced staff in first, and then gradually feeding back in your more experienced staff.
There's somebody from who's dialed into the webinar this afternoon, who has agreed to furlough, but now insists they want to come back. So they said, I thought the staff had to agree to furlough, but it sounds like that this has changed.
Well, that particular person already has agreed to be furloughed, because they're already on furlough leave, and furlough leave is ended at the employer's initiative, not the employee's initiative. So the employee can obviously make the request to come back. But as we were mentioning earlier on, if the employer has concerns, I don't know whether there's some sort of health issue, or there's no work for the individual, or what it is, but if whatever the circumstances are, the employer is in a position to say, I'm sorry, I appreciate you'd like to come back to work, but I'm afraid your furlough leave is going to have to continue for another month or whatever it might be. And then, of course, later in the summer, then we've got the options of bringing people back part-time. So that might be the answer to some of those kinds of situations.
And Andrew, did you want to come in on the chat? Andrew,
hello.
Hello there. You okay?
Yeah. Thank you. I just wanted to mention briefly, because this is slightly off topic, but I just wanted to mention briefly that we've been doing some work on helping companies with gauging their commercial readiness to return after the lockdown. Health and safety obviously is the most important thing, but business, I think, may come a close second. And we've teamed up with a couple of consultancies, so we're focusing on their supply chain, so the readiness of your supply chain to help you to return after the lockdown. How ready are they? So that's what we're doing, and this is a combination of consultancy and software. Now, the software we have is called ClearChain, and it's specifically made for non-financial auditing. So if there is any interest in that, you can find us on the Chamber's website. You can find me, Andrew Lambert, and our company is MCL, or Marshall Consultancy Limited. Just get in touch with me if it's of interest. And we also have, we're happy to help registered charities at no cost. So we can give them a degree of help, which we think will be probably useful. So I just wanted to mention that. So thank you.
Thank you very much, Andrew. And it's just an opportunity for me to also say, for members of the Chamber, that it's a great way to share your services, member-to-member offers through our website, any news stories, any updates and everything, that Chamber provides services so that you can actually help promote and market your business a lot more. So please do look at that. And for those that do wish to consider joining the Chamber, we are offering a discount this month as well. So it's a great opportunity to start looking at the commercial way, how you can start to grow your business. There's lots of free services, lots of discounted services, but opportunities to interact with other members and businesses in the Chamber. We as a Chamber have already put our risk assessment together, and we're in the stage of consulting with our employees, because I think that's an important step as well, that you do consult with your employees to get feedback if there's something that you haven't considered or something that there's a risk and a concern to them. So please do carry on looking at our website. We will have various webinars. We're setting up our sector-based forums again, and we have various virtual training courses available for all businesses. So please have a look at our training courses. There's lots there ready to get your businesses up and running. And because we're now in this recovery, or should I say restart recovery stage, and all of us need to look at how we can start to generate revenue, get our businesses growing and help economic growth in the area. But thank you so much for joining me. I would like to take this opportunity to thank you very much, Harry.
Yeah, you're welcome, Anna. Thank you, everybody, for attending, and I hope you find that useful.
Thank you. Bye-bye, everyone.